Hello, today we are with one of our patients who just got their fixator out and they're getting their physiotherapy session. I'm going to be asking them a couple of questions. Hello, how are you?
Hi, I'm fine, thanks.
I've prepared a couple of questions to ask you.
Okay.
So the first question is, before the surgery, what were the most positive and negative comments you heard about the limb lengthening from online or your relatives?
So I didn't hear anything from my relatives because it was never discussed with my relatives, as it's a personal thing for me. But I'd say when I started doing the research, some of the positive things I realized about limb lengthening is, of course, you will be taller. So that's great for any short person or somebody who desires to be taller. So that's one positive. Another positive I would say is, you get a bit more recognized. You have a presence when you walk into places, like you go into a supermarket, you go into a restaurant. When you're bigger and taller, those people tend to get more reception from people. So positive, yeah. So negatives, loads of negatives, of course. You have the detractors, people who would be totally against limb lengthening. Like, why would you go do surgery, can you not be happy with yourself and just accept yourself for who you are? And those same people, they go and do a teeth remove, what's it called, teeth changing or whatever they call that surgery. They would go and do hair transplant, but then when it comes to height, it's certainly it's like a taboo thing. So those are the negatives I found out, and I never really discussed it with anybody. But of course, from my research online, going into forums, you see people saying, oh yeah, negative, you're gonna go ruin your life, you're gonna break your bones. If you go to places like Turkey, they're third world countries, and you're definitely gonna destroy your legs, you will never walk again. So those are the negative comments I found out about it.
And what was the very first thing you felt after the fixators were removed? Like physically and emotionally?
To be honest, pain. That was the first thing I felt when I woke up. Pain and extreme hypothermia, cold.
Oh, wow.
Yeah, pain and a lot of cold. So hunger, because you can't eat for like about 12 hours before your surgery. So I was very hungry. Then as the pain started to wear off, I felt relief. Okay, at the first day after surgery, on the day that the fixators were taken out, it was pain. Okay, they had my legs wrapped up in a thick bandage, so my legs were very stiff. I couldn't feel my legs.
Yeah.
But then the next day, I felt like, there's nothing attached to my legs anymore. When they took off the bandage and my legs were free, I felt relief. Then there was no pain anymore. It felt like, now it's just weakness. My muscles are weak because they've been locked into a position for months, and I've been like stretching. So clearly, I felt, even till now, I feel a lot of weakness, but free. You feel like, like you can rest, you can sleep properly again, and you don't have those pins in your imagine having pins in your bone for 3 months, right? And some people go as far as 5-6 months, because they're doing 2 limb sections. So I felt good after the bandages were taken off my legs. I felt good.
So you're finally completely starting to recover now. Now the fixators are out.
I would say with therapy that I'm getting done now. Daily physiotherapy sessions help with my mobility, flexibility, strength in the muscles, and just listening to what my physiotherapist recommends, and I just follow his recommendations basically to get faster recovery.
And considering this is a really challenging journey, what would you want to say to people who are considering getting this surgery as well?
Very interesting. I would say to people, you need to really analyze, and you need to reflect on your life, and initially reflect on all the experiences that have brought you to this very moment, right? That you start thinking about doing it, because it's definitely not something to be taken lightly. You need to research the company you're going to be doing it with. If you're someone who's preparing to go to a foreign country to get the surgery done, do a few things prior, like try and learn a bit of the language, so that when you get there, you can have a bit of communication, with people. Save up enough money, not just the amount of money for the surgery. You're gonna need like some extra funds, to buy medication, to buy food, to take care of yourself, because you're here in a foreign country, like you're on your own. Try and come with a family member or a loved one, if they can come with you during the whole time. I think it makes that process easier. Unfortunately for me, because I kept it personal to myself, I had all these things, and I thought them through before making the decision to travel here. So I knew I was going to be alone, and I just prepared myself mentally for like whatever challenges I was going to face. So yeah, for people who decide to do this, you have to be mentally tough. Like you have to be a bit crazy, psycho, because it's like going to war. You have to be a soldier. Like you just have to know in your mind, look, I'm going to be incapacitated for a period of time, like completely disabled. I'm not going to have use of my legs anymore. You're going to be in pain every day. Actually, no, let me not exaggerate. You wouldn't be in pain every day, because it's very relative to the individual. Like everybody has different experiences.
Experience is different.
Some people said they never felt any pain after the surgery. I felt a lot of pain. So you just have to prepare. Train. Go to the gym maybe 2-3 months before. Try not to put too much work on your legs. Just work on your flexibility. Do a lot of stretches, leg stretches. Because you're going to need to do that prior. And try and do that 2 to 3 months before traveling. For your upper body, you need upper body strength. You need tricep strength. You need chest strength. You need your obliques, core strength. I'm not saying everybody should go to be a gym buff, because there are people here clearly who don't go to the gym and they're still doing it. But I'm saying if you want to have an easy process, if you want to feel good, for me, like that's what makes me feel good, like going to the gym. Even when I had the fixators on, I was still going to the gym. I was still working on my upper body, because I know I was going to need that after removal, because now, since removal, I've been using my upper body strength to kind of take most of my body weight, because the legs are still weak. So you want to do things like that. You want to be able to just prepare your mind, body, spirit. If you're a religious person, take your Bible, take a Quran, because you're going to need that motivation. Bring your lap. Just know in your head, I'm going to be in this place for a period of time, 3 months, 5 months, whatever, and just prepare for that. You know, and I think you will have a successful experience. But the main thing is research. Do your research on the company you're going to be selecting, and make sure that you've covered all your tracks. Ask all the questions. Try and get your company to share testimonials with you, like previous patients, people who have done the surgery. If possible, get them to put you in touch with an ex-patient who's completed their surgery, and then you can speak to them directly, because I did that. You guys were able to link me up with this guy in America, but he was in the States, I was in the UK. There was a bit of a time zone problem, exactly, but that still worked, and I was able to get the information I needed, to get me prepared, and I think if you have all that in place, just plan. If you have to be a planner, be able to plan things. Don't just do it erratically. Some people take that risk, but you're not gonna die. You know what I mean? Like you won't die. It's something is happening now. It's been happening for a very long time. There's loads of surgeries now.
Research around it
and they're safe. You just have to make sure that you're doing your part as a patient. Listen to your therapist, eat healthy, and obviously the obvious: don't smoke, don't drink. Because that will affect your recovery if you do those things. And it should be a smooth process for whoever's planning to do it. So.
Thank you for the advice. I think you gave really good advice to people who are considering. Thank you guys so much for watching, and we wish you a good recovery from now on.
Thank you.
Yeah.
Thank you very much. Okay.